It started slowly, almost like a whisper. In the early days, no one knew what was coming. The virus was a phantom, creeping through the lives of the people it touched, taking them by surprise. It didn't have a name at first. People just noticed that their friends and family were getting sick. The signs were subtle at first. Weight loss, night sweats, flu-like symptoms. For most, it was dismissed as just another cold. But it wasn't. It was HIV. By the time HIV was recognized as a real threat, it had already woven itself into the fabric of the nation. Men, women, and children were being diagnosed. The disease didn't discriminate. It didn't care if you were rich or poor, young or old. And for years, there was little anyone could do but watch it spread. AIDS, the advanced stage of HIV, was terrifying. People with AIDS could no longer fight off infections, and simple colds turned deadly. Their immune systems were compromised, and once healthy individuals became shadows of their former selves. The symptoms became increasingly devastating: constant fatigue, persistent fevers, sores that wouldn't heal. Their bodies wasted away, and soon it was clear that HIV wasn't just a virus. It was a national crisis. And the stigma made it worse. At first, the government didn't take it seriously enough. Denial, misinformation, and discrimination took hold. The disease was labeled a punishment for certain behaviors, and people who were infected were shunned. Many believed that HIV and AIDS were only a threat to specific communities, not realizing that the virus could spread to anyone. Fear drove people to distance themselves from those affected, isolating them, not just physically, but emotionally. For many, coming forward with an HIV diagnosis meant facing rejection. Parents turned away from children. Friends severed ties. Employers discriminated. People started living in fear of not just the disease itself, but the social consequences of having it. HIV wasn't just destroying the immune system. It was unraveling the social fabric of the nation. It wasn't until entire generations began to feel the effects of the epidemic that the country began to wake up. Health systems were overwhelmed, and funeral homes were constantly busy. Economies suffered as a workforce of capable young adults fell to illness. Schools saw more orphans as children lost parents to AIDS. The threat of the virus didn't just lie in the symptoms. It was its potential to bring the entire nation to its knees. The turning point came when education and empathy started replacing ignorance and fear. People realized that HIV wasn't a death sentence if treated early and properly. Antiretroviral therapies emerged, giving hope to those diagnosed. The symptoms could be managed, and people could live long, healthy lives if they had access to medication. Public health campaigns began to focus on prevention, teaching people about safe practices, testing, and the importance of early diagnosis. But the battle was far from over. The virus was a silent storm, constantly lurking, waiting for people to forget the lessons learned. It wasn't just about treating those who were already sick, but about addressing the systemic issues that made certain populations more vulnerable. Poverty, lack of education, and social inequalities contributed to the rapid spread, and the nation had to confront those problems to fight HIV effectively. Now, decades later,